Hi there. My name is Larry Brandt, and I'm here with the famous Dr. Inoue, who has a very interesting paper from King's College Hospital in London and the Showa University Northern Yokohama Hospital, in which he discusses magnification NBI for the diagnosis of early gastric carcinoma. And what he actually did was review the Japanese literature for Western gastroenterologists. And the people in Japan have great experience with early gastric carcinoma, as you know. So I guess my first question to you is, what are the current thoughts about why gastric cancer is so much more common in the East than it is in the West?
Originally we have lots of advanced gastric cancer. And then after introduction of the Helicobacter pylori eradication, incidence and the number of gastric cancer reduces even in Japan. But still, number one, number two, same. So number one is the gastric cancer, incidence of the gastric cancer. And then second incidence is colon cancer, but almost same in Japan. So two major disease in the GI tract. So major reason why is we have a lot of HP infection in the past.
And HP infection is now diminishing.
Yeah, diminishing. So dramatically, particularly after indication of eradication of HP. So after that, the number of gastric cancer cases reduces in a younger generation. For example, age of more than 70, so actually 70% of the population was HP negative. And then a younger generation, now even in Japan, less than 20-year-old, so incidence of HP infection is 5% or 10%
Really?
like that. So dramatically reduced. But the cancer age is 60 or 70. So still we have a lot of gastric cancer.
But in Japan, the cancer is much more often superficial than it is in the United States. We just don't see superficial cancer the way you do. Why is that?
Yeah, so that is a Japanese history. So in the past, so 30 years ago, so when I was a resident of the medical school, at the time, so most of the patients died from the advanced gastric cancer. So at the time, so everybody, all the doctors realized in order to improve the prognosis of the gastric cancer, easy way is to detect the disease in its early stage.
Mm-hmm.
If we can detect the early cancer, so less risk of lymph node metastasis or other systemic metastasis, or less and less. So we can simply improve we hope, improves the prognosis of the gastric cancer.
So
then I'm sorry. Then
no, I'm sorry. Go ahead. Finish your sentence.
Then the Japanese government so started to do the national survey, performing a regular screening endoscopy. So more than 50-year-old age, as mainly a male, but they now are both ladies and gentlemen both receive an annual checkup of endoscopy. So government recommended.
So when you do the endoscopy,
Yeah.
and do you use magnification NBI?
Yes. So currently we use magnification and NBI, but that is a characterization of the tissue.
Right.
So first thing we do is a detection of the region. So in order to detect the region, so magnifying endoscopy is not necessary. So first thing is during screening endoscopy, at the time, so for example, we spray indigo carmine, that is a chromo, and then enhance the elevation of the deflection of the mucosa.
So the first thing, regular endoscopy, white light endoscopy
That's
with
right.
indigo carmine.
Yeah.
And that enables you to see differences in surface elevation.
That's right.
Okay. Now you see a surface elevation.
Uh-huh.
What do you do then?
At the time, so we perform NBI magnification. So
Okay.
we always combine the magnification endoscopy and the NBI. So that NBI emphasizes the surface structure and also vascular structure. So very easy to observe.
How does Helicobacter pylori change your ability to determine normal or cancer?
So generally, the patient who suffered from the HP infection, gastric mucosa is very irregular and the very, so what should I say, very, anyway, so irregular.
Okay.
And it's a very, not regular. So sometimes very difficult to identify the early cancer. So now our strategy when we find out HP infection at the time, so we perform the eradication first, and then after eradication, gastric mucosa becomes
More regular.
more stable. Yes.
How long do you have to wait for that to happen?
6 months.
So how do you detect H. pylori? By looking
Yeah.
or by stool test or blood test?
Yeah, of course. So one of the blood tests, the antibody, and then second one the
Let me go back and ask a different question.
yeah.
If you
Yes,
want to screen a
I cannot
population,
remember-
that's okay.
I-
If you want to, your English is better than my Japanese. If you want to screen someone, do you first do a blood test or do you go right to the endoscopy?
Like to the endoscope.
All right, so you go right to the endoscopy, you see something, it looks like Helicobacter. Maybe you biopsy it, maybe you don't.
Yeah. So take biopsy and
Okay,
the urea.
Helicobacter and inflammation.
Yeah.
You treat that patient for 6 months. 6 months later, you go back again, and then you do your NBI and your magnification, and you try to get a better look at that area.
That's right.
Okay, and after that, that's really you do the magnification first, help you find the area, and then you do the NBI. You look at the surface pattern, the capillary network. How am I doing? Okay?
Yeah. So like that. So first thing is a regular endoscope.
Right.
Now magnifying regular white light endoscope,
Right.
and then detects the region.
Right.
Sometimes we use a chromo endoscopy.
Right.
Anyway, after detecting the region, we close up to the region,
Right.
and then we switch to the NBI. So NBI is always together with magnifying endoscopy.
All of that together, how good is it?
Yeah, great. It's great. So detection, so we can see everything. So microvascular structure or microstructure and microvascular change, both.
How much
clearly.
experience do you need to be able to tell cancer from normal or H. pylori?
Not so difficult with H. pylori, with infection H. pylori. So even though we can discriminate both of them, not so difficult.
If
So-
I came to you and I spent 2 weeks with you, would that be enough for me to become good at
Yes,
it?
I think so. So we have lots of accumulated endoscopy image of non-neoplastic mucosa and the neoplastic mucosa. So you can, if you check it, and then 2 weeks is enough.
So I don't even have to come and stay with you. I could do that in my home.
Yeah. Using the internet.
Thank you very much.
Thank you very much.